And for more, let's bring in our guest, Dr. Marta Feldmesser. She's Chief of Infectious Diseases at Lenox Hill Hospital in Manhattan. Doctor, well, every single person I've spoken to, whether they be on the administration side in the hospitals or on the front lines in the ICU or the ERs, to a person, they are talking with almost a palpable sense of dread that while every effort is humanly being made and there's unbelievable dedication, the wherewithal to treat what is going to come very soon, whether it be with the ventilators, obviously, or the other necessary goods, just isn't there. Is that a fair description that from every projection here that the demand is going to way outweigh the supply?
Well, that is the projection, and I think that people are trying very hard in a variety of really creative ways to try to create the capacity. And we're starting to see the efforts, of additional PPE being delivered, ways in which people are going about trying to procure additional ventilators, increase the number of hospital beds, and people are really working very, very hard at this to try to bring it about.
People say that we are a week to 2 weeks behind what we're seeing playing out in Europe, and more specifically, they're saying that pretty soon, if not already, we might even replace Europe as an epicenter for this. Take a listen to what a couple doctors on the ground had to say in Italy, and then I'm curious if you think that's going to be us in another week.
Every single square meters is occupied by beds. Every single aisle is filled up by beds. And you can hardly recognize where you normally work.
The worst is somebody dying in the isolated ward, asking for the wife, the husband, for the last hours of their life, and having no chance to have anybody around and dying on their own.
You've heard a lot of people say that that could be us in a week's time. I'm sure, obviously, within the medical staff, you've had those conversations. We've already seen, you're fast-tracking graduates in medical school, maybe even 1 year early, to help join the fight. Retired doctors and nurses, I think very heroically, are joining on the front lines also to fight this. To that end, as you yourself get ready to deal with already what you're dealing with, but in a more acute sense, looking at the projections, do you look at Italy and say, that's probably what we're going to be looking at in a week's time, or not?
I hope not. I sincerely hope not. I mean, there's no question that the hospital is going to be filled mainly with patients with COVID-19. There's no question. We're already, sort of rapidly moving in that direction. But I think that Italy was a little slower than I would have liked to have implemented in their implementation of social distancing. And I also think that Italy's population is older, just in general. So that I think that, my hope is that what's happening there will not happen here.
One of the challenges, as if we needed any more, is that there has been mixed messaging. Every day, seemingly, there's dual messages, one coming from either Albany or New York City from Governor Cuomo, and then later in the day we'll hear from the administration, more specifically the president. This is what he just had to say yesterday, and given your expertise in the field, I'd love for you to react to it.
We lose thousands of people a year to the flu. We never turned the country off. We lose much more than that to automobile accidents. We didn't call up the automobile company to say, stop making cars. We don't want any cars anymore.
To that end, in terms of, again, telling the public what we should practically be expected, the idea that this is going to be turned off nationally in a couple weeks, let alone comparing this to the everyday flu, COVID-19, I would assume, and correct me if I'm wrong, you don't agree with either those projections or that comparison.
No, I really don't agree with that comparison. I mean, look, a lot of people do get the flu, over 1 billion cases worldwide. But you're dealing with a disease where basically nobody in the population has immunity. And so that is really, that's one difficulty. Everybody's susceptible. And the messaging has to be very much towards social distancing if we're going to stop it circulating through everybody in the population so that we can protect our vulnerable. If we don't do that, we're going to have a very, very big problem. And so, no, I don't agree with the messaging of everything needs to be restarted. I don't agree with, the idea that this is going to be over in a couple of weeks. I think that the epicenter will shift, hopefully, or start to shift, but there's no way.
Doctor, in terms of the optimism or cautious optimism as it relates to the treatments and then longer term a vaccine, but for the here and now, the possible treatments to mitigate the effects of people that are obviously already positive for this virus, where do you fall on the spectrum here in terms of how advanced they are, how ready they would be to be put into mass circulation, and their effectiveness?
So the treatment that you hear bandied the most, hydroxychloroquine plus azithromycin, which is an antimalarial plus a commonly used antibiotic that also has anti-inflammatory properties. I mean, there are anecdotal data to suggest that they may be beneficial. There are no actual published data, at least that I have seen, and I don't think that it can be considered anything other than experimental. There are some therapies that are antiviral medications. There are a couple of them that are starting in clinical trials, but again, that's clinical trials, not widely available. There are also, some immunomodulators that are being used and being studied. Again, the data are very, very limited that they are effective. We need data. We need science.
Doctor, thank you for the time. And again, best of luck in the days ahead. Thank you.
Thank you.